While patient is not on treatment, albumin levels are at the high end of the normal range, and alpha-1 and alpha-2 globulins on the SPEP test are within normal limits. However, during treatment with Pomalyst and dexamethasone, albumin levels drop below normal, while alpha-1 and alpha-2 globulins increase above normal. Could you explain the reasons behind these changes? The changes you're observing in albumin and alpha-1 alpha-2 globulins on the serum protein electrophoresis (SPEP) test during treatment with pomalidomide, Pomalyst, and dexamethasone can be explained by their effects on protein synthesis, inflammation, and liver function. Here's a breakdown. 1. Albumin decrease with treatment. Inflammation and stress response. Pomalidomide and dexamethasone can induce systemic inflammation or stress responses. Albumin, a negative acute phase protein, tends to decrease during inflammation because the liver prioritizes the production of acute phase reactants, e.g., alpha-1 and alpha-2 globulins, over albumin. Dexamethasone effects. Corticosteroids like dexamethasone can increase capillary permeability or lead to a redistribution of albumin, further lowering serum levels. Underlying disease or treatment toxicity. Conditions such as multiple myeloma, for which pomalidomide and dexamethasone are often prescribed, may exacerbate hypalbuminemia due to disease progression or treatment side effects, including gastrointestinal toxicity or reduced protein synthesis. 2. Increased alpha-1 and alpha-2 globulins. Acute phase reactants. Both alpha-1 and alpha-2 globulins include acute phase proteins, e.g., alpha-1 antitrypsin, haptoglobin, ceruloplasmin, that rise in response to inflammation. Pomalidomide can cause immune modulation, leading to increased cytokine production, e.g., Illinois 6, TNF-alpha, which stimulates acute phase protein production. Dexamethasone effects. While dexamethasone suppresses some inflammatory responses, it can also indirectly enhance acute phase protein production through its effects on cytokine signaling. Drug-specific effects. Pomalidomide has pro-inflammatory and immune stimulatory effects, which could further elevate these proteins. Summary of mechanisms. Without treatment, albumin remains in the high normal range, and alpha-1 alpha-2 levels are normal, reflecting baseline protein synthesis and an absence of significant systemic inflammation. With treatment, albumin decreases, negative acute phase response, and alpha-1 alpha-2 globulins rise, positive acute phase response, likely due to a combination of drug effects, inflammatory cytokine production, and immune system modulation.